Welcome to the 17th episode of the Millennials. I'm your co-host, Liz, and this is my other co-host.
I'm Sequoia.
And we actually have a very, very special guest with us here today. Someone who's very near and dear to our hearts.
True that.
She is my little cousin, though by 9 months, but more like a little sister, and I love her dearly. And she's actually here to talk about, drum roll please, sexual and reproductive health. We're going to get into who she is, how she's gotten to where she's gotten, and we'll get into some sensitive, fun, sexy deets. Healthy deets.
That was cute.
How are you, Miss Anlee Buice?
Beba always says this, or Elizabeth, or Liz to you guys. It's Anlee, but ever since we were little, so it's just like we just roll with it. But yeah, Anlee Buice now. I used to be Guillaume, but now I have a middle name, so I'm happy about that.
Yeah.
Is Guillaume your middle name now?
Yeah, because I never had a middle name, so I just kind of slid everything over. But Buice, like Miami Vice, but with a B.
Period. Yeah, she married to my cousin-in-law, Demont. Shout out to Demont.
Yes. Thank you for having me, you guys.
Thanks for coming.
Yeah.
You're our second guest. I
so
love
excited.
that for us.
Yes. Because I think your first guest was Ashley, so we're keeping the A's.
Yes. Okay, maybe a little. We will do a little alphabetical order. Next, Brian Joe.
I love that. Yeah.
I do want to say, okay, so tell us a little bit about your background. Obviously, we're coming in the medical perspective, but obviously we all went to Florida State University together.
Florida State.
What did you study there, and then where are you now?
Yeah, so at Florida State, I was a criminology major, so I'm a criminologist, and it wasn't until my junior year that my mom actually told me about physician assistant. Now we've changed our name to physician associate, but it's still PA, just to, so that patients and just the world would recognize us better because we're not the assistants of doctors. So it's like kind of like, I guess, like maybe in the law space, like an associate lawyer or partner.
Like
or something.
Partner.
Yeah, exactly. And so I stayed at FSU a little bit longer. I was a super senior to get my prereqs. And then I applied to PA school. I was a non-traditional applicant because I had a degree in criminology. So traditionally, PA applicants will major in like biology or chemistry or something in medicine. I have to stop saying but yeah.
No, you're fine, trust me.
Girl, listen, we say all the time.
No, seriously.
Yeah, so you just have to have your bachelor's degree and then take the prereqs, so you'll have your bios, your chemistries, anatomy and physiology, things like that. And my program was exactly 2 years, so 24 months. The first year is what we call didactic, so it's in classroom where you're learning everything, and then the next year is where you do your rotations. So you rotate through women's health, surgery, what else? ER, all the things. But PAs are what they call, we're taught as generalists. So I'm a Gemini too, don't judge me, but I like to know a little bit about everything, and that's kind of how our profession is. So we're like a jack of all trades.
Sweet.
So the difference between a PA and a nurse practitioner, like fundamentally, is that we don't have to specialize. So if I decide I really love women's health, I can do that for a few years, and then I can transition to like family medicine or something like that.
Or like psych stuff?
Yes, exactly,
Sweet.
which I do. My minor's in psych, and I enjoy psych too, so
That's really
I
cool.
can do that later on down the road. But primarily my focus has been women's health, and to get my patient contact hours, I had to work as either an MA or we have to get hands-on patient contact hours in order to go to PA school. So I did that at Planned Parenthood. So I spent 7 years at Planned Parenthood.
That's awesome.
In Tallahassee. So our population was mostly like college students. So I got to see all the nitty-gritty.
I know you saw some crazy
questions
shit.
now.
Okay.
Yes.
Okay.
All the fun stuff.
I know you
I
saw
really
some
enjoyed
stuff.
it. I think Planned Parenthood is a great organization. 90% of what they do is preventative care. I know that people like to talk about the other things, but 90% of what they do is preventative care. So STD checks, we do see men, STD checks, treatments, pap smears, birth control, all the things. For me, it was really nice because I got to be really hands-on, but I also got to educate and advocate for patients as well too, especially in the college scene, because you're seeing patients for the first time they've been to the gynecologist, or they're starting birth control for the first time, or they're like, hey, my roommate slept with my boyfriend and now I have chlamydia, like what do I do? So yeah, it's all the things, and it was fun. It was really, and honestly, just kind of like the name of Florida State carries with you. Yeah. The name of Planned Parenthood carried with me, and they taught me a lot of stuff. So I really owe a lot of credit to them. I will always stand up for the organization. I enjoyed a lot of my time there.
Can I ask, like, did you guys do abortions? The A word?
Yeah. So we did. When I first started off, I think I started in 2017 is when I started with the organization. At first, we were only doing what we call, we were only doing family planning services. So family planning is under the umbrella of birth control, STD testing, pap smears, breast exams, things like that. And then we moved to a new clinic, and then we started doing medical abortion, so just the pill. Okay. And then slowly they transitioned it to surgical abortions, which some people may also know as a DNC. So DNCs are not just elective. You can have to get a DNC.
What's a DNC?
Dilation and curettage is what it's called. So essentially, they go into this, they dilate the cervix.
Right. That's like the more aggressive.
Yeah, which is what we would call like a surgical abortion.
Yeah.
And then you evacuate the cervix and remove all the parts.
I love the medical terms for it.
Evacuate.
So we don't get flagged or anything like that if I say
sure, absolutely.
Yeah.
Did you guys have any crazies try to like protest or bomb the clinic?
Yeah, so a lot of
Listen.
No, sometimes. So other clinics would get bomb threats. So we would would get bomb threats. So on our newsletter, we would get to be on the lookout for certain things, or they call them BOLOs. You guys probably are aware of that. But who to look for. A lot of the times when we moved to our bigger clinic, we had just like little old ladies praying for us. So I'm just like, I'm not mad about that. Go ahead and pray, you know? And then sometimes you get the more aggressive ones that would come inside, but then a lot of the times they're just, just trying to get something. Yeah. And, but they were never anything thrown or some of the crazy stuff that you might see online. It was very tame. So most of the things that I would say is that I've gotten is just ladies praying on the side.
Were you ever nervous? Like, were you ever, when things were like heightened, were you ever nervous or like worried about going into work?
No, I wouldn't. I kind of actually like a little bit of like, scariness. Yeah. So it was kind of like, and that's that's not the reason why I picked Planned Parenthood. I just knew that they were going to teach me a lot. But I always felt safe. We have a barrier when you check in, or at least the clinic that I worked at had a barrier when you checked in that was bulletproof, glass. We had badges in and out that you have to check in, so nobody can just come in. We have to. The front desk has to buzz a patient in. We confirm before. So I never felt unsafe. And then even when we would park, it was in a gated area, so nobody could come in unless you had a keypad or a code to get into our parking space. But I kind of like a little bit of element of scariness because my degree's in criminology. So I'm like,
I do too. I work with mental health patients. It's like there's a little bit of like, a little.
You've worked in jail.
I know. I love. Yes. And I always tell. It's funny. Somebody literally today, because I had like an intake, and I was like, working in the jails was actually my favorite.
I love that.
And they were like, why? And I was like, I don't know. I just like the.
Yeah.
You want to work
spice
in jail
of it all.
Yeah, I want to do correctional health as well too. I think that's a really underserved space, and
for sure.
Yes. Oh my gosh. Yeah. Specifically, I would love to do psychiatry, because I feel like just because you did something bad or something bad happened to you doesn't mean you don't deserve adequate health care.
I mean, they're humans too.
Exactly.
Like at the end of the day, bad decision makers. Yeah. But humans, know. And I was telling my client today, like, listen. We've all done some shit, and the difference is we haven't gotten caught.
Exactly.
Right. That's it. You know, I don't think there's one perfect person walking the earth. So they just, just got caught.
Yeah. I totally agree with that. So. Yeah. And it's an underserved area a lot. But it's funny because I've talked to some providers that I've worked, whether it's doctors or advanced practitioners. That's another word that you can call either a nurse practitioner or a PA is an advanced practitioner. And they love it. some have worked in private practice and they're like, I'll never go back. I love correctional health. I feel the safest because you're always with a guard. And some of them have been able to make their own schedules as far as like, because you'll see units at a time and they're like, that might be something that you're really interested in. So yeah, we'll see. Maybe later on in my career.
Yeah.
But I would definitely like to do like federal prison because that pension is great. So
hell yeah.
Yeah, that and the VA. So look out.
I'd love to see you in the federal
Period.
prison. Maybe I could be a warden one day or something.
Girl,
I want to be a warden.
I know you would.
They'd love to have you too. Do you want to do men or women?
Madam. Madam Joseph.
I definitely want to do men first. I'm a little scared of women.
Yeah.
I was talking about that today. I was like, honest, because I worked in an all female and an all male facility, and I was like, I think I like the males because males, like, you don't have to guess what they're thinking. You don't gotta like, they're gonna fight it out, get it out, and then they're done. Females, they hold grudges.
That's true.
They're petty.
Yeah.
They're catty. You just like never know
Not
what you're gonna
shaming
get.
our own.
I know.
Listen, I'm telling you, but it's true.
Call a spade a
Females
spade.
is-
Yeah.
Yeah.
Sometimes they're a
we
little
could
bit
be ruthless.
Yeah.
Ruthless.
Yes.
Yeah, I don't want a woman scorned.
I'm telling
okay?
you,
Someone's
when
gonna
women
like,
scorn, they be having and they're like, women are smarter than men, in my opinion, and
No,
so
it's
they
true.
are more savvy with how they go about things, so
sure.
they're hiding
Definitely.
things in places you don't know about, and
For sure.
making something out of nothing.
Yeah.
They're
Especially
Animal. I see Orange is the New Black. child.
that's what I'm
you.
saying. Especially in that environment, it's like
Yes.
everybody's out for themselves. So
women be
just because you're providing healthcare for them, just because you're providing any service to them, doesn't mean you're any different. So I definitely feel that. I feel like men are more chill. They can still get over on you, but I feel like we're a different breed.
Definitely.
Just,
we're
Do
different.
you feel like in the medical space, are you taken seriously by men, or do you like get flirted with? Or
That's a good question.
Yeah, so I would say that most of my experience, I've worked in predominantly female-dominated spaces, so I don't really encounter that. I've had like a handful of male doctors that I've worked with, and it's always been really nice. But thankfully, I've worked for a very progressive company. The only time I guess I would experience, it's really just like patients. When I was on rotations, I did most of my rotations, all of my rotations were in South Florida and the Miami area. So I saw, it was always the male patients, especially in family medicine, when it's time for like a digital rectal exam or we have to test for like a hernia, and they'd be like, "Oh, you're so beautiful," It's Miami.
while
so
you're going in the booty,
Right.
literally.
I'm just saying, yeah, they'd be like, "Oh, you're
Out
so
of control.
Yeah, men don't care.
That's
it's
what
like,
I'm saying.
yeah,
You'll never got to
know?
worry or guess or wonder
Yeah.
because they're going to tell you
Yeah.
every time.
The only experience where I've gotten where, because PAs in general will get this a lot. They'll be like, "I want to see the doctor." Or like, "Who are you?"
Ooh.
Yeah. And I'm like, "Okay, well, actually, you're seeing your provider is actually a PA, but I'll get you the PA, no problem."
Yeah.
So I did get that a couple of times, but it was from females, and it's like, come on, man.
Catty.
Yes.
Stank.
Exactly.
Bitchy.
Proving your point. After I've looked through your whole chart, I know how to help you out.
Right.
I'm telling my preceptor, actually, you need to look out for this, that, and the third, but I want to see the doctor.
What's a preceptor?
So when we go out on rotations, you have someone pretty much that is looking over you. And it could either be a PA, a nurse practitioner, or a doctor. And for my family medicine rotation, it was a PA. So he'll evaluate you. He'll kind of see how you're operating, how you're doing your physical exam, and you shadow him for maybe like the first day or first few hours, and then when the preceptor feels comfortable, then they'll kind of let you do your own thing. They also do your like evaluations, how you're caring for the patients, how you're writing your notes, things like that. If you have good clinical judgment, so just someone that's looking over you. You're a trainer pretty much.
Isn't that what you are now?
What?
But for therapist, what do you call it?
A qualified supervisor.
A qualified supervisor.
Yeah.
Okay. Go get qualified by Sequoia. Child.
Period.
Yeah, essentially that, and we are working underneath their license.
Yeah, so it's like the same thing. Yeah.
Yeah.
Beautiful. So please, I want to get into the nitty gritty.
Let's do it.
You
The
got some
nitty
questions?
the nitty gritty.
Yes.
Literally, right? Like
What
the
is
nitty-gritty.
the nitty gritty? So speaking of sexual health, reproductive health, what is the most common sexually transmitted disease that you've seen?
Gonorrhea and chlamydia for sure.
Okay.
It's what they call not the silent killer, but what they call, the silent disease. Because most of the time you don't know that you have it. There's like an incubation period. So we tell patients, because I would have patients that would come in and right after they had intercourse be like, I want to get tested. Well, there's an incubation period of 3 weeks is the soonest that we can test you.
3 weeks?
Yeah, for gonorrhea and chlamydia.
Wow.
And most people don't have symptoms, so that's why we say test regularly. So if you are regularly sexually active, I would say at least once a month you can come and get tested. And when you do have symptoms, it's not too late because there are curable. That's why they've changed it from sexually transmitted disease to sexually transmitted infections, STIs. Yeah, because you can cure it. It's usually just medication. But some of the symptoms, if you do have symptoms, a lot of the times you've had the infection for a long time. So you'll have like burning while you pee, and you might have, for females, you might have different discharge, whether it's smelly discharge,
or
green discharge.
I've heard of the green discharge.
The green can be a couple things. It could be trichomonas. It could also be gonorrhea. And for chlamydia, sometimes you'll have like what we call like a mucoid. So it's kind of like a mucousy discharge.
Like snotty?
Yeah, exactly. Yellow sometimes as well too. And then sometimes you might have like pelvic pain because these infections for women, they cause pelvic inflammatory disease, also known as PID.
And is that like if it's untreated or just in general it can cause that?
So it's treatable, but the damage that has been done. So even if we treat it, it's been done.
It's like the damage.
So the damage is infertility. And the same thing can...
Go get tested, ladies.
Yes,
yeah, that's
get
scary.
tested. If anything's off. So I used to say this during my intakes. I'm like, some of you all may be too young for this, but your vagina should smell like water, just like Ply said. There should be no scent to it.
Clock it.
All those summer's eves and whatever, it's like gynecology tested.
Right.
No, our vagina is a natural cleaning mechanism. All you need is water. The worst thing you could do for your vagina is douche because it takes out the good and the bad bacteria. It's just kind of like, it's just a flush. So you don't want to do any of that. But yeah, get tested. And it's fun when you're like, sometimes I've seen couples come in and get tested, and safe sex is great sex. So there's no shame in it. I think when there's no shame in getting tested. If you're someone who likes sex, there's no shame in that as long as you're protecting yourself and you're getting tested. And you can make it like a fun date night. Be like, oh, you get to have the goods once we get tested. And then what we consider a full panel is going to be gonorrhea, chlamydia, HIV, and syphilis. That would be a full STD panel. And then you can also go into the HSV 1 and 2, which is your herpes simplex viruses. But most people have herpes, so really, unless you're having like an outbreak, and you get frequent outbreaks, so sometimes outbreaks can be on your mouth, like cold sores that we're used to getting. They could also be on your genital areas. That sometimes will come with like burning, sometimes itching. Patients will say like, hey, I felt like an itching, and then I got like a bump or like a cluster of vessels. And they like to come, the outbreaks come during times of stress. So let's say you've been like sick recently, then you're like, okay, now I have a cold sore. Or we used to see it a lot in the clinic that I worked in Tallahassee during finals week. And everyone's like, oh my gosh, I have, so-and-so gave it to me. Unfortunately, when it comes to herpes, they don't have the technology yet. Even if we test you, so there's a culture, which normally we do the culture, which is like a swab on the vessel if it's open. That will tell us if it's isolated. So isolation just means that that's probably where you're probably going to get your outbreaks. And if you want to know between if it's HSV1, which is normally orally, or HSV2, which is normally genitally, then we'll do a blood test, and it tests for the antibodies. But the test doesn't tell who gave it to you, when you were exposed. It just says somewhere in your life
at some point in time
you were exposed to the virus. So that's when we have to be a therapist and explain, be like, hey, it's not your partner. It might not have been your partner. It could have been that your mom kissed you when you were younger.
Oh,
yeah.
Goodness.
Yeah,
That's interesting. I never knew that.
Yeah.
And so the virus sheds even when it sheds even when you're not having an outbreak. It's less likely to shed because it's called like your viral load. when you're having an outbreak, your viral load is more increased, but when you're not having an outbreak, it's suppressed. But it's less likely to transmit, but there's still the risk of transmitting it.
Sure.
So the best thing that we do is we tell patients when you're having an active outbreak, avoid any skin-to-skin contact because that's how it passes. So unfortunately, condoms don't protect you. You still use condoms, but they don't protect you. I had a case one time that it was a patient, she didn't even have any penetration. She was a virgin, and you know what we used to call back in the day hunching. They were just hunching.
Y'all know dry humping because some of y'all call hunching.
Yeah, that part. Thank you for the clarification. But yeah, so they were dry humping with their clothes off, and she had one of the worst outbreaks. Like she could barely walk. So sometimes outbreaks will get that bad where the patient
really?
and she's like, I don't get it. I didn't even have sex. And I'm like,
that sucks.
yeah. So
damn. So in an instance like that, can she say it was the dude?
Unless you're getting a full panel, which most people, because it tends to open up a can of worms where it doesn't need to be. So most of the time when you're getting STD testing, they're not testing for herpes because it's very common. So actually, I lied. So, well, maybe not lie, but the most common STI would be herpes because most people have it. But technically, you can't spread it. You can spread it when it's not sexual. It's skin to skin. So that's why it's not really categorized as that, if that makes sense.
Okay.
But yeah, most people have it. So rather than opening up a can of worms, because imagine you're coming in to the doctor and you're like, hey, I want a full panel STDs. And then we put in HSV 1 and 2, which is the blood test. And then it comes back positive and you're calling us like, what's going on? Do I have to notify? And it's like, no. So most of the time, unless you specifically ask for it or you have an outbreak, we're not testing you for that.
Okay.
We're just testing you gonorrhea, chlamydia, HIV, syphilis. There are reportable STIs, so gonorrhea, chlamydia, HIV, all the STDs are reportable to the health department.
Syphilis really is though, right? I had a client who had syphilis before, and the health department actually called them to like verify.
Really?
Yeah, that they had it. It was crazy.
Yeah.
Just because, like, it's just what?
I think 'cause the severity of it, right?
And you're considered, considered a public health risk.
Yeah.
Because we don't
like
want
on your record.
I don't think it'll be on your record, but because we don't want everybody running rampant with syphilis or chlamydia or gonorrhea, things that can be cured. So they even have providers that will go out with officers in law enforcement to make sure because I don't know why people evade getting treatment. But most of the time, if you go to your local health department, it's free, you guys. So like, don't think you're going to get a bill. Like maybe if you go to your provider, but we have to treat it. So I don't know why people evade it, but people do. I actually worked with a nurse practitioner, and she was like, yeah, I used to ride around with the police and go and treat people because people would just like, they think they're like the bill collectors or something. It's like, no, we just want to make sure that your dick doesn't fall off.
That's so, that's so interesting. Not the sexual PO.
Yes. I think that would kind of be fun too. You're almost kind of like a bounty hunter, but like
for STI.
We're looking for the girl with syphilis.
We're looking for the syphilis girl.
Yes,
that is very
So were y'all you knock on somebody's door like, I know there's somebody in here with syphilis.
Yes, you knock on the door and then with the medication, make sure you take your medication. Yes.
That's kind. Like Meals on Wheels.
They don't want that shit spreading around.
Exactly.
Imagine if there was a syphilis outbreak. Yeah. Or like a, what is it called? Epidemic?
Yeah, we don't need that.
Could you imagine, bro?
It's crazy because I did my, what is it called? It's not the persuasive essay. But what's the essay where you're just like
where you're explaining?
Facts? And that was my first college essay. I was on syphilis. Yes.
Did you pick that?
I did. My persuasive was abstinent, so it kind of was like, well, be abstinent, and then also
here's what can happen if you're not.
Yeah. The abstinent one, everyone was just like, look at me. Like, I know this girl is a hot damn lie. At Florida State in the summer.
No, be real. No one's doing that.
Somebody, the message touched somebody.
Amen.
If not myself.
She's a vessel, honey. That's a vessel right there. I know that's right.
So get tested, get treatment, complete your treatment.
Even if you're not having sex. Clearly.
Well, so for herpes, you can still get herpes even if there's no penetration. You can still get gonorrhea and chlamydia, even if you're just providing oral sex. So
wait, can you get it orally?
Yes.
Child. So not green discharge out the mouth.
It wouldn't be more. It wouldn't be like that. You would have like a sore throat, things like that, and then a lot of these infections will go systemically. So like throughout your whole body. So sometimes you might get. It's called like septic arthritis. So if you've had it's usually gonorrhea, but if you've had an STI for a long time, you can get like joint pain, you can get inflammation. You can get infected arthritis if you don't. So it's very, very important. I just
don't know why anybody wouldn't want to get treated for that. Like,
but they don't know, maybe.
Know if like some green discharge is coming out of your vagina.
We do, because like females, we have more moving parts, so it's a little bit easier to tell. Like, there's even an infection called bacterial vaginosis when our pH is off. Literally, you can sneeze and your pH is off, which is so annoying.
No, literally,
pH is off.
Yeah, and then sometimes you might have. They classically, like in the textbooks, they call it's a fishy odor that you might smell, but really, it doesn't always have to be that. It could just be like you just don't smell like you normally smell, or like I said before, you're supposed to smell like water. You might be like, oh, I kind of smell a little bit yeasty down there, and then we're talking about a yeast infection. So when you're off. It's harder for guys because they don't have as many moving parts, so it might be a while before they've had it, and then unfortunately the test doesn't tell you how long you've had it for. It just now you're like, now you finally came and you got tested, so cool.
I have a question.
Yeah,
it's along the lines of vagina smelling like water. Are you supposed to wash your vagina with soap?
Not inside.
Okay.
So none of the lips. So just on the outer part.
Not the outer lips.
Only water, because
Can I just say I've only washed my vagina with water for years.
Yay.
Really?
And every time I tell people that, they're like, oh my God,
perfect patient.
And I'm just like, bro, you're not supposed to put anything. It's like a precious pearl down there. Like,
you were taught well.
What are you putting?
Whoever taught you, you were taught well.
Yes.
Because
so clock that.
Yes, that's what I would call
water down there, and that thing cleaner than a clean.
Okay. That's what I would call a perfect patient.
Thank you.
Perfect patient, you guys. I love my perfect patients because you really don't need anything, and
you don't need nothing.
It's unfortunate because you have all of these companies out there gynecologically tested. Now, I will say one thing, if you are and then just some people, because of their chemistry, are more prone to bacterial vaginosis. We'll just abbreviate it BV, more than others, because you have a mix of good and bad bacteria in your vaginal flora is what we call it. So vaginal flora, you also have a gut flora to keep your gut healthy.
Yep.
So what I would recommend, if you're someone who gets UTIs, BV a lot, a vaginal probiotic. It makes it's like a multivitamin for your vagina. That's the best way I can explain it.
Yeah.
So that's what I recommend to patients. Get the vaginal one, because I have had patients that get the gut one and they're like, I'm just like have gas and I still have BV. It still feels fishy down there.
It's crazy. Yeah, I feel like I would get BV when I did use soap, like back in the college and stuff. I used to be like, what the hell? And I stopped putting anything down there. Yep. No issues.
I gotta try it out. I'm just like aggressive the way I'm just aggressive in general. Like I fully come like an Asian. So I've been being down there for since childhood. Like I don't know what life is about. But then I will. So you just water.
Just water.
Yeah, because if you think about it, you're introducing something into your body. And now your body's like, what is this? Like, I have to try to flush it out. And that's really essentially what BV is. Your body sees something, because all your body is trying to do is be in homeostasis, or like an equilibrium to your body, be balanced. So anytime you introduce something new, your body's like, okay, we got to fix it. We got to do something. So that's why the increased discharge comes. That's where like that odor comes from.
What
just
about
the outside.
The anus?
Yeah,
you could wash.
I put soap in my booty hole.
You can do
Not in it, but like
yeah,
around
not in it. But yes,
like
yes.
I wash my booty with soap.
Yes.
But that's your freshest flower.
But I said your vagina, not your booty. Your
But
booty
it's
is
not
nasty.
precious
Shit
either?
comes out of your asshole.
Okay.
Yes,
That's
that is
yeah.
okay. And then if you are going to use soap, nothing inside, and you want to use like an antibacterial soap, mild antibacterial. You can use Dial or Dove or something. Yeah, it's an antibacterial.
No,
Were you
Dial,
using
yeah.
Dial in your cooter cat?
On the outside.
Oh.
On the outside. Yeah.
Dial, Dial.
Dial
I
will
used to use
dry
that.
your shit.
I used to use Dial and we'd be white skinned. Like, what is that?
Bro, Dial will have
If you
out here
absolutely need to, but
like
honestly,
a dry sponge.
It works.
if you absolutely need to, antibacterial, you could choose your brand, you guys. Choose your whatever brand that you want to.
Yeah, don't use
My-
Dial. You're going to be out
Not
here.
Summer's Eve, not douches.
Nothing please don't douche. That's the worst thing that you can use for your vagina. The best thing, your vagina is a natural cleaning mechanism. It's very powerful. There's a lot, just like your body. It's going to take care of itself if it needs to.
It's like the portal of life.
Mm-hmm.
You
Literally.
gotta treat it as such.
Literally. So be gentle to it. Don't be scared to look at it.
Mm-hmm.
I know a lot of,
No, I be all up in that thing.
as you should be,
I
because
do. I
that's
want to
just-
know what it looked like.
perfect patient. You see what I'm saying?
Because
Because a lot of the times,
Anlee, you make me. I'm so glad you're here.
I'm glad. Thank you for having me. I'm so excited because
Yeah.
I get like on my little soapbox, and I really am like I'm an advocate for women's health. I love sexual health. I think it's important to talk about. It's taboo, but yeah, don't be afraid to look at your vagina, because a lot of times when we're going to the doctor, it's usually when something's wrong or like once a year. So and then you're trying to talk to someone and tell them like, oh, it doesn't normally look like this. I don't know what it normally looks like, but if you're telling me like, hey, like this normally isn't here, or like that is, so you know your body the best. So don't be afraid. Get a mirror down there.
Sure do.
I remember when I started birth control in college for the first time, the pills, I just could not do the pills. The hormones were just too much for me, and I was like a cottage cheese factory down there. I never had a yeast infection until I started birth control pills. But so birth control pills are essentially like the hormones that your body makes. They're just a synthetic version. And some people, just like with BV, how some people are more sensitive to getting these infections, I was just really sensitive to hormones. So my first ever yeast infection, I was like, oh my gosh, this is so itchy. I don't understand. Like, comb to the vagina itchy, and just like cottage cheese factory. And at the moment I stopped hormonal birth control, it was done. Now I am on birth control, but I have a copper IUD, so it's no hormones in it. Essentially, I have like Arnold Schwarzenegger in my uterus.
Do you want to talk about the copper IUD?
Oh yeah.
So, what is that? I'm
Yeah.
like, what is a copper IUD?
So it stands for
Non-explosive.
IUD stands for intrauterine device, and there's different forms. You can have hormonal ones, you can have a non-hormonal one like I have, and it's like a T-shaped device, and there's copper thread around it. So sperm hates copper, so once we place it in the uterus, it stops you from the sperm coming up, so it'll mess up the sperm in some type of way. Either it'll like cut off its tail or break off its head. So it's like it deviates from
a little killer in there. Damn.
It deviates from the egg coming down. Versus hormonal IUDs will stop you from. It'll like make your cervical mucus thicker, so it's harder for sperm to swim up and fertilize the egg. It can stop you from ovulating, and some will even stop you from getting your cycle. But it's not bad if you don't get a cycle. Like if you're on the only time it's bad, because I know a lot of patients or a lot of people in general will be like, oh, I don't have a period, so that's freaking me out. If you're on a medication that makes you not have your period, then it's fine. It's when you don't have any extenuating circumstances and you're not getting your period, that's when we're worried about it. But a medication that stops your period is going to be progesterone, and most of the hormonal, they call them LARCs, and LARC stands for long-acting reversible contraceptives. Those will have progesterone, or some form of progesterone, and that will essentially thin out your endometrial lining, so that way you either have a really, really light period, or some people have no period at all.
Okay.
Yeah.
Crazy. And so, you are not going to be able to get pregnant while you have it in. You take it out, you're absolutely fertile. Not absolutely, but.
Yeah, you can start trying right away once you remove the copper IUD. All birth control is the LARCs are 99.9% effective, so there's still that 0.1%, and it does happen.
I believe it.
You know, I did work at Planned Parenthood, and I did see people who were fully on IUDs, and they're like, I did what I thought what I was supposed to do, and I'm like, yeah, like what is going on? I would say the larks are probably like what our providers would call the Cadillacs of birth control, because it's like a set it and forget it. You don't have to worry about it. Versus other methods like pill, patch, and the ring. Those are harder because it's user error. So
I forgot about the ring.
Yeah, the Nuva ring. And now they have I think they have another brand as well too. I forgot what it's called, but those are harder when you bring human error in. You might forget, things like that. So those are less effective. So if you're going to do anything, I would do a long-acting reversible contraceptive, a LARC.
Are there some that are in your arm?
Yeah, so there's one that's called the Nexplanon, and that has a form of progesterone in it, and it's good for 3 to 5 years. So you get numbed up, they slide a metal, or they slide it's like a plastic rod, and then the rod has hormones in it, and that diffuses throughout your body every so often, so that way it protects you.
It's how do they make a little thing?
Little do you know, they're just putting a chip in you to track your ass.
I don't know, because that's crazy.
It's in our RUDs,
you
guys.
You can have a little device
that's what
you
it
use
is.
for 5 years.
3 to 5 years, depending.
What the hell? Like, seriously, like, that's insane.
Yeah.
No,
listen, they're
really
those
crazy.
pharmaceutical companies, they're
Big
making.
Pharma don't play.
What? They are.
I'm trying to get her to be Big Pharma.
Yeah.
Who?
Anlee, take us
Okay.
out the hood, baby.
I need to come up with
Child,
something. Yeah.
Don't mention nothing.
Yeah, don't say
But
nada.
trust me.
I'll just come out and
There
you'll
will
see.
be signs.
Be like, dang, she came up like that.
Right.
Wait.
I can't wait. We're putting it out there in the universe.
Period.
God,
Whatever
please
it
bless
is,
me.
Lord.
Yes, I
Please
need to
bless
pay
us
off these
all.
student
Bless
loans.
us all, child.
I'm trying to pay off these student loans. I still owe Florida State.
Did you
Girl,
see the
don't even
house,
talk about
the
it.
Fall of the House of Usher?
No,
on
I didn't.
Netflix?
What's that?
Oh, okay, they're a pharmaceutical family.
Okay. Is
That's-
that the one
they're
with
filthy.
what's his name's what's her name's husband? Sarah Jessica Parker?
I don't know her husband.
Okay.
Matthew Broderick.
Yes.
Ferris
No, that-
Bueller, right?
That might have been the opioid, like, there was like a series, it was like the opioid epidemic, or like how it came to be and stuff like that.
Okay.
But I'll put that on my list.
This one's like a fun show.
Okay.
Yeah, it's
No,
like
this
not
one's like
serious.
dark.
Yeah.
But you guys should watch it. It's pretty good. There's a bunch of things
I'm
on.
getting my fair share of dark right now.
We're watching The Hunting Wives.
The Hunting Wives is actually
Oh my goodness.
dark.
Oh, you watched it.
I watched it, finished it.
Don't tell me anything.
No, I won't.
I have
won't.
2 more episodes.
Okay.
Liz has got me watching this show, and like, I just be looking for my jaw. Like most episodes, I'm like, where's
I
my
love good white woman TV.
It's good.
It's
I
like
enjoy it.
it's a white woman TV gold. Like, you know how like sometimes there's like a good Lifetime one or a good like Hallmark one. Like, I feel like The Hunting Wives is a good little white woman show.
Yes, it is. I do like. I'm not gonna go as far as to say that.
yeah, like this girl.
But it is. It's a cast of full of white women. It's
Yeah,
like,
well, there is a
But we're black
woman
women watching it.
but it's like if I were to say I like black cinema. If I'm watching Spike Lee joints as a white person, you're not going to call that white cinema.
I don't know if I would call it any. I think I would just call it a Spike Lee
Well, they
joint.
called them Blackbusters on BT.
New Jack City,
So yeah, you're watching
my
Boys in
those
the
God.
things, and if
Hood.
they're just trying to explain, like, hey, I like black cinema. It's like, I know what you mean when you say black cinema.
Okay.
The Hunting Wives is white women's TV for us, by us, for them, by them.
Brittany Snow's in it,
First
right?
off,
So it's like
Brittany Snow, number
Yeah.
uno. I don't
Yeah.
even know who Margot is, but she's the queen.
I know. I feel like I've seen her, but her husband I've definitely seen before, and I was like, I like him.
Oh, I like him too.
yeah, I've always liked him. I'm
For
like,
sure.
I don't know. It's giving
Yeah.
like you might have a little like you're not just white. I don't believe it.
Yeah, a little Latina.
Something.
Jet back.
All right.
Now, watch The Hunting Wives if you haven't already. I know you guys will see this probably in September or something. We don't know. There's
It
some
is
time on our
literally-
films.
It is good though. I did enjoy it. I think I binge watched it in a couple of days. It's good.
Yeah, that's what we've been
Yeah.
doing. I have 2 more episodes.
I heard that they're coming out with the new season too. But
Really?
I mean, I feel like they
Period.
have to.
Yeah, no, it's kind of like
Yeah.
Yeah, don't
the-
tell me
Well, no, we won't
anything.
go into
Yeah,
too much.
don't
Yeah,
go.
but I
Yeah.
love that. I have a question.
Yeah.
So in The Hunting Wives, they talk about like Texas doesn't have abortion clinics. Does Florida have them?
So, as far as I know, and mind you, I haven't been in the sector in a couple of years since I've been in PA school, but as far as I know, it's still legal. but it's 6 weeks.
I was gonna say, I think it's like 6 weeks.
Yeah, which is like
when you basically find out you're pregnant.
Not even, yeah.
Like,
so it's like no time.
So basically, no.
Yeah, it's terrible. So after Roe vs. Wade was reversed, we left it up to the states. So every state is different. Florida happens to be at 6 weeks, and at 6 weeks, most of the time you're doing the pill. But I would always say to patients, but if I had my choice, I would do a surgical abortion.
Really?
Just because it's like you're going in there, you're getting it all done. It's usually guided by ultrasound, and we know we've gotten all of the contents out of your cervix, or your uterus, sorry. Versus with the pill, we are trying to miscarry you. And it could work, it could not work.
And if it doesn't, does that...
We have to go back and do a surgical abortion anyway. So it's like you
I
might
was
as
gonna
well.
say, like, can the pregnancy persist and like then you've got complications with it?
I haven't
like birth defects or something.
Yes, I haven't experienced that, but there are statistics that. So when I did medical abortions, working at Planned Parenthood, it's a 2-step process. So you take the first pill, which, if I can remember, I can't remember the names, but the 2 names within the abortion pill is mifepristone and misoprostol. Misoprostol is going to dilate your cervix, so make it soft, to soften the cervix up. And I believe there's another pill. There's a pill that you take that stops the growth of the pregnancy, and that's where birth defects can happen, because we don't know what happened. Because the second half of the pill, we leave for the patient to go home and take on their own within a certain time frame. So hopefully you take it within the time frame. Hopefully you decide to take it, but we do have them sign a contract that's saying that, hey, if you take this first pill in office with us, you have to take the second half, because if not, your risk of birth defects go up, death, bleeding, all different types of complications. So technically, you're supposed to take the second half because you've signed that contract, but things happen. And I think that's probably where the statistics come as far as like people still going through with it.
Changing their mind real quick.
Yeah, exactly. And you really can't do that.
Wow.
So that's another thing that I really pride Planned Parenthood on doing, is we were really educated as supporting staff, to the point where I feel like we were very complimentary of the providing staff, like the nurse practitioners and the doctors, because you're getting full education top to bottom, even if this is your 4th or 5th, and there's no judgment on how many times you want to do this, but we educate the patient. We offer birth control at every single visit, and sometimes people say no, and it's just like, no? Okay.
6'1", but all right.
You're going to do natural family planning, because that is a method of birth control.
What's natural family planning?
So natural family planning is, when you're ovulating, when your cycles are. So when you're ovulating, that's when you're your fertilist. I don't know. Yeah, I don't think that's a word.
Fertile.
That's when you're most fertile. And if you're trying to get pregnant, that's when you want to have intercourse. But if you're doing natural family planning as a method of birth control, you want to avoid intercourse during that time. And it works. I mean, it's worked for years back in the day.
Right.
The statistics drop, like I said. The rhythm method, which is like
this is
pull
the
out.
Rhythm.
Yeah,
What's the rhythm?
The P&P method.
Yeah,
pull out and pray.
pull out and pray.
Why did you guys? What is this? I never heard of it.
Because it's like known. So I
You
think
never
it's
heard
like,
of the pull out and pray method?
Yeah, so I think it's like so we call it the withdrawal. The rhythm method, I think, is natural family planning. So it's like you're based on the rhythm of your cycle is when you're having intercourse or when you're avoiding intercourse. So
I can't believe you've never heard the P&P.
No.
Well, I feel like also as like Haitians, they like I never had the birds and the bees talk like until like I was.
I'd be talking to my mom about sex all the time,
and I love that.
I haven't had
it. Great, and it's
crazy.
No, it's crazy.
And it's interesting because like I didn't have that, and my mom is in the medical field as well too. My mom's a nurse, and I don't think we had that talk until
That's crazy.
maybe when I got my period, but it wasn't even a formal talk, or like I think I had gotten in trouble. Like I invited a boy over and I got caught, and then it was like, you're going to the doctor, you're getting all testing, you know.
Oh my god!
And it was like, you know, make sure he wasn't inappropriate with me.
Who comfortable talking to me?
I
about
love
sex.
that though, because it doesn't make it scary.
Oh my gosh, she talks to me more than I want to. I'd be like, girl, I do not need to know.
I love that. I love that.
I remember being in college and being like, okay, mom, like, I think you went to the gyno. I was like, okay, like, I'm going to go make an appointment at the gyno. And she's like, why? And I'm like,
because I have a vagina.
What everyone else is doing. Like, what the hell? Like,
yeah.
It's like, bro, I'm like 19. Can I go to a gyno? It's like.
No, I know. It wasn't really talked about. And technically they say, I remember, I think I was in middle school or something. I had asked the nurse at I think it was just like a primary care doctor, when should I start going to the gyno? And my mom was quiet because she wanted the nurse to answer. And she said, when you start getting your cycle. And I was like, that kind of makes sense, because now that
things are moving.
Exactly. And now that I'm versed in these things, you can catch things a lot earlier. You know, like, hey, I could be 16 or 18, still haven't gotten my cycle. Well, if I was going to the gynecologist, by the time I got my period, we can see like, hey, or I could be more educated, because I had a lot of patients who just didn't know anything. I've even had patients that have came in and said, like, I think something's wrong down there, just because they, you know, weren't getting like as wet, or, you know, sex wasn't feeling good. And it could have just been like, they didn't have foreplay. And I'm like, well, tell me what's going on. Like, does your partner go down on you beforehand? Do we do any type of foreplay? And they're like, no, they just stick it in. Oof. You know, college kids, you know. So it's just like, no, sweetie, like there's nothing wrong down there. You just need to get a little bit warmed up before things happen.
So cute.
But you don't know that if you haven't been taught that, you know. Yeah. So I think it's healthy. Maybe not to the extent that you were saying. Sometimes it can be a little like, okay, because even sometimes I'll have parents that will come with their children, and we have to ask some personal questions like, how do you like to have sex? What type of sex do you have? Oh, wow. What partners do you have? So if they're still within like the minor age, I'll tell the parents like, hey, do you want to excuse yourself? I usually do it during, we ask IPV questions or intimate partner violence questions. I'll usually do it during that time, just to make sure you have, because we're mandated reporters. I say we because Sequoia's a mandated reporter as well too.
Period, mandated.
And I think you are too.
I think we all are here.
We all are mandated reporters.
Serious circumstances.
Yes, so that's
to a life.
Exactly. So that's a time where I choose to ask the intimate things. And I'm like, okay, mom or dad, you can come back in now. And then sometimes I have parents like, no, I'm going to stay. And then once I start asking, what type of sex do you have? Vaginal, anal, order. Yeah, they're like, oh, okay, I'm going to leave. And I'm like, I told you, I gave the disclaimer, but you want to stay.
Right.
Okay.
I have a question.
Yeah.
So when you're going to the gyno, obviously the gyno, they check your private parts. Because I think I've gotten like molested by a doctor when I was younger in a weird way.
Okay.
I was getting a sports physical, and I was still, this was at the time where I would still bring my parents to the doctors, in the doctor's room with me, because it's like we weren't doing anything special.
Yes.
And the doctor was like, no, my dad had to go.
Oh, hell.
Because he had to do something invasive, and he literally took my pants down and turned me around and spread open my butt cheeks. And like looked and did whatever, but then like I was telling my friends after, I was like, dang, like I didn't know that like they did this in the sports physical. And they're like, no, they don't.
They don't. I'm so sorry.
It's funny, but I'm just like, because he didn't do anything, but like he literally just spread it.
That's
looked at it, maybe like captured a mental photo.
No, and that's what's so sad about it too, is because like we're in these spaces where people are the most vulnerable. So like, I'm sorry that happened to you, but that's not normal. Especially depending on how old you were. Yeah, I know. I know, but still, it's like, yeah, that's
why she's a vessel.
Literally. Yeah, that's not normal. Even so, when I was on my pediatrics rotation, shout out to CHI at West Kendall, Cuban Central, and I had you know, you go to your pediatrician all the way up until you're 18. Some pediatricians will even take it as far as like I think 21, and then they stop. And I've had 16-year-olds, 17-year-olds. We will do penis exam or a penile exam. We do a testicle exam just to make sure you don't have like testicular cancer. Make sure if you're not circumcised, hopefully your parents have taught you, you know, like you got to bring down the turtle, you got to wash it and things like that. And then to let them know signs of like testicular torsion, which can cause like infertility, loss of a testicle, things like that. But even all those exams, the parent is still there. So that's why I say, like, no. The only time the parent isn't there is when we're asking intimate partner violence questions, because your abuser could be your caretaker. So that's why we ask them to leave the room. I just make it a habit, just because it flows a little bit better with my conversation, to ask, like, hey, are you having sex? Or if I was at the pediatrician and I have like teens, I will ask them, be like, are you having sex? Do you have a girlfriend? Do you have a boyfriend? You know, are you guys having sex? What are you guys doing? Hey, you know, if you want to get on birth control, whatever. And I would still use Planned Parenthood. I'd be like, hey, you know, you can go to Planned Parenthood if you want.
Not plugging.
Yeah, because the pediatrician doesn't do that. Yeah. They might give you like maybe like a 3-month
little pamphlet or something.
Yeah, exactly. Then they'll be like, oh, go to your, you know, gyno or
when I went to
like
Sagard, like for the first time, I took all the pamphlets. Like what they had, like a whole bunch of pamphlets.
Actually, you wanted to be well informed.
They were doing a HIV testing, and I was like, because I was a little activist, I tried to get a big group of us to go to get tested for HIV.
Did you?
I don't think yes, and I think the only person actually that came with me was Rob, and.
That's awesome, though.
But I'm a virgin, and so they're asking me all these questions, like, yeah, like, have you had sex with a monkey? Have you?
And I'm
like saying,
monkey?
Yes.
Oh.
But I'm saying no to all of these things, right? This crazy question.
And they're like, why are you here?
Yeah, she said, why are you here? I was like, girl.
Because
it's HIV test week, honey.
I love that. But yeah, why are you here for HIV specifically? Because
I would just, you know me, like, I felt like because I had brothers and I used their towels or something, like, I didn't trust boys, boy.
What's the craziest, like, patient story, or what's the craziest, like, you know, thing you've seen that you can think? Yeah, obviously, don't tell me names or anything, but just like,
I don't think I remember the names, but the craziest, I would say I don't even think it's crazy. It's just like, I guess it is crazy, is the married men that would come in. And I had this one patient, he admitted I had a slip up with, a lady of the night. And
I had a slip up? What is a slip up?
We listen and we don't judge.
No, we don't. We judge when you're full of shit.
But
I'm sorry.
You be giving crazy stories too.
I do, but I would say a slip up.
Okay, yeah, you're real.
Like, I had that's not a slip up.
I had to come correct so he was exposed to STI. I think it was either gonorrhea or chlamydia, one of those, and he didn't want to tell his wife. And remember, as I said before, most of STIs are reportable because we don't want a public safety hazard, a bunch of STIs that are treatable. And I said, you have to tell her. I said, if you don't tell her,
I'm going to tell her.
the health department is going to tell her.
Yeah.
And yes.
Do you want it to be you or the health department?
Yes.
Petty.
Because she needs to get treated because like we talked about before, PID, infertility, all those things.
Yeah.
And she has to get treated. And he was just like, can I just drink water?
Huh?
Yeah, that's what I said.
Water.
I had to fix my face, and I was like, it doesn't work like that.
Good job.
Maybe if you had a UTI, which it's rare that men will get UTIs. It's like a very rare occasion. So, but it's not like it does happen, but it's very rare. So maybe you could drink a lot of water, cranberry juice for a UTI, but not STI.
Not for chlamydia.
Yes, I
or
said
gonorrhea.
no.
His like pee was probably burning, so he thought like if I flush out the burn.
No, he wasn't even having any symptoms because, like I said, most men don't have symptoms until they probably had it for a long time, and that's how we know they've had it for a long time is because they've had symptoms. Yeah. And he was just like, yeah, I had a slip up with the lady of the night, and I'm trying to do the right thing.
By getting tested?
He knew that girl was not.
Yeah, he knew that broad was dirty. She was the lady of the night for everybody.
And he got something.
Yeah.
That's what you get.
And
nasty.
so, do you know if he ended up telling his wife?
I don't know if he ended up telling his wife, but he had to because he was positive because at the time that he was coming, we didn't know. I don't think he ever came back to the clinic, but we just called in I gave him a good stern talking to.
He didn't tell his wife.
If his wife didn't come back to that clinic,
She didn't know.
No, but yeah.
Oh, God bless.
Yeah, that was one of the craziest when a patient was like, "Can I treat gonorrhea and chlamydia with water?"
but
He played
how
too much.
does the public health system? How do they inform the wife? Like, how do you get that notice?
Don't they call?
Yeah, we call. So I don't know how they get. So sometimes we have patients who will give they're like, I don't want to call a partner. It might have been like one night stand, whatever. But they'll have the number, so they disclose the number to the health department, and that's how I guess they find the number somewhere.
They
I
be
don't
finding
know.
it.
Yeah, the government. Listen,
People
want to be like, I don't want the government to know.
Yeah, they know.
They know.
They know.
I don't know how they know.
Listen, the fact that they take your footprints and handprints when you're born.
Exactly.
Yeah.
What you think that's for?
And then we still have to get them. I'm like, why do I have to renew my handprints?
Yeah, you got that little baby thumb print.
Literally. But they know. They found out some. And then I was towards the later end of my years at working at Planned Parenthood, Tallahassee, because it was all the STIs were running rampant in Tallahassee. They actually had those texts that you get. Then they started doing text messages like, hey, someone you know has tested positive.
Oh, no.
For STI,
We would've been
you
so
should
scared
probably
of that.
get tested. They don't say treated. They said like, hey, someone in whatever, you probably know. And it's, it's one of those. So sometimes they don't always call, but they might text. And then sometimes the health department will call us, because I used to have those. It was like once every morning.
Yeah.
Once a week. The health department would call, and we'd have to go through our list of patients and be like, hey, these people were found positive. Have they been treated? Yes or no? And then what were they treated with?
Wow.
Yeah.
All your business.
Exactly.
No.
Exactly. So
I think so. I think we are probably about to wrap up. Is there any last words, any last thing you want to say?
Anything you want to plug?
I don't. Yeah, get tested. Safe sex is great sex. It's fun sex, and yeah, I think that's about it.
That's a good message.
Yeah.
I like it. Yeah. Thank you
love
for coming,
you.
Thank you for
Anlee.
having me. I love you guys. This
love
was so
you.
much fun.
Yeah.
Right?
I'm a little chatterbox, so thank you
I
guys.
definitely think you'll be back on the show.
Oh, yeah.
Oh, I love that.
We
Love
need
that.
you to come back.
Yeah.
Yes. And support
Educate
Planned
us some more.
Parenthood.
Okay, girl.
Yes.
And support us, okay?
Period. Yes, support
Like,
them.
comment, share, subscribe.
Period.
Subscribe.
Subscribe.
And
subscribe.
find us on our Instagram at The Mental Millennials and our TikTok at sequoia.liz. Okay?
Thanks, guys.
Thanks. Keep that veg clean, girls.
Clean your veg with water.
Yes.
Be clean.
Yes.
Water can't wash away STIs.
Or sin.
Or sin. Lady of the night juice.
Ooh, child.
Bye.
Okay, bye.